This is the KOHO 101 Community Connection Podcast. Check back often for a continuing look at business in the greater Wenatchee area.
It's the KOHO Morning Show. So nice of you to join us today, and looking forward to another discussion with our friends from the Wenatchee Valley Chamber of Commerce. Their Executive Director, Shiloh Burgess, in for an installment in our Community Connections podcast series with the Chamber. Today focusing on Confluence Health, and we've got three guests in from that camp, including Casey Vogt, Student Coordinator at Confluence, along with Jason Morley, the Director of Talent Management, and Josh Brack is here as well, Management of Talent Acquisition at Confluence. Going to be talking largely about workforce and workforce development at Confluence today with this quartet of guests. And Shiloh, Casey, gentlemen, I appreciate the time. Thanks so much.
Thank you for having us. Good morning and hello, everyone.
Good morning.
Good morning. Hello. So, Shiloh, you've packed our house today. In fact, I'm out of microphones. We're sharing, so.
We are sharing with
That's
such
good.
a great, amazing group of people, and we're hoping to hear a little bit about their story. Confluence is a major employer in the region. Just learned, we got the number, it's over 4,000 employees that, get to go to work every day with Confluence and help us stay healthy and get better when we're not feeling better, or deliver babies, or do all sorts of amazing things. And I think that's where we kind of want to start is there's a lot of different talent opportunities, use your words, for employees at Confluence Health. So talk to us a little bit about the variety of jobs that Confluence provides in the region.
Sure. There are opportunities really at every level, whether you're a provider of healthcare, meaning a physician, physician's assistant, nurse practitioner, someone specializing in behavioral health. There are those opportunities. But in addition, there are all different manner of job openings currently, certified nursing assistants, nursing opportunities, supply chain, environmental services, and the list goes on and on. I think currently we're somewhere in the neighborhood of about 400 and change openings as of today.
So how are you finding the talent to fill those openings? How does that work?
It's a great question. It gets harder by the day, honestly. The nature of work in kind of a current pandemic era is that people have decided over the past year or so, either we were a two-income family and we can live on one income. We needed to stop work to take care of our kids because they weren't in school. I don't want to work in healthcare because that sounds scary. And I don't know. There's a lot of unknowns there. I have spent my life working really hard, and the pandemic has taught me that there are other things out there that I want to focus on, right? And so it has made it increasingly difficult to fill certain roles. And then I think for us, what we're trying to do is educate the community that there are more opportunities than just clinical jobs. One of the things we're going to try to start floating is you can kind of grow your career with us. It's a great opportunity. We're large enough, over 4,000 staff members, lots of different opportunities that you can come in and work in food service while you're still in school at Wenatchee Valley College and getting an education, and then you can come over and switch jobs into something else. We are working on highlighting certain people in the organization that have done that. Our IT help desk lead was started for us in food service, and now he's answering everybody's IT questions and helping them, problem solve. And so I think there's a great opportunity there that I hope we can show the community that it's not just a job. You can go get a job at a lot of different places. But you can come have a career with us that you can really be proud of. You can make a huge impact to the community. Whether you're working in EVS or at the bedside, what you do impacts the people that live here in a really substantial way.
Right, and I would agree with that, Josh. I started at Confluence before we were all one company. I started at Central Washington Hospital as a CNA. I came in through home health, eventually through transitional care unit, went to school, became a nurse. Worked in nursing for a number of years, eventually became a practice manager for the outpatient departments, and then found my way into HR, and now I'm working closely with talent. So there are many career paths and career opportunities. Just because you start in one role doesn't mean that you are in that role for your entire career.
Has to be one of the rare institutions where that can be said in this day and age, where you can actually start in one department and go through another and then finish in another department, perhaps even regardless of what kind of outside training you actually retain. So that's a good way for us to rope Casey Vogt into this conversation with Confluence as well. They're student coordinators. So essentially, what does that mean, I guess, first of all, Casey? We hear student in connection with a large medical organization like Confluence, and we could think of all kinds of things. So what are we talking about as far as coordination of students at Confluence?
Yeah, well, thanks. I think what's important to know is that Confluence Health is very student-friendly. We love to have students in our facility, but we're not an academic institution, meaning we're not University of Washington, medical center where we have constant flow of students. So it does take some effort to bring students in. But what we're really talking about is anybody with that student label. We're talking about high school students. We do a number of programs for high school students throughout the year, and I can talk about those a little bit later. All the way through any student that's enrolled in a clinical program, so nursing students, CNAs, medical assistants, occupational therapists, physical therapists. There's over 35 different types of students that we have. All of those students in clinical programs are required to complete training on site with actual patients, which makes sense. You would hope as a patient that your students don't just learn on cadavers and mannequins before they come to treat you. And then we also have medical students from UW and WSU and Pacific Northwest University down in Yakima. So we have medical students and residents throughout the state that come to do different rotations with us. So really anything that has that student label is something that we coordinate. And let's see, last year we had over 2,300 student rotations. So that's anything from a high school kid that came to do one of our summer camps, or a college kid who came to do a job shadow, medical students, anybody who came to do any kind of educational experience. We had over 2,300 even in 2020. It was busy.
Yeah, sounds like it. Are there opportunities at Confluence, just curiously, for residencies, for fledgling doctors to actually come and get part of their residency?
It's a really good question. We're not actually a residency site, but we have partnered with CVCH, Columbia Valley Community Health, has a residency program out of Chelan that we've partnered with them on, which is also a partnership with UW, and where they have 2 residents that start every year, and it's a family practice residency program, and so they go through that program and rotate with our specialists. So we have those residents that come, and we, of course, are trying to recruit them to our area heavily, and that's part of their goal of going into that, as well as other residency programs. We've had a resident from Spokane before that has come. So there's about 4 or 5 residents throughout the year that come and do different rotations with us, just depending on what they're looking for.
Yeah, I really love that you brought up the work that you do with high school students, because one of the things we have adopted at the Chamber over the years is our Careers After School program, and Confluence has been a huge partner in that several times, and it's eye-opening. Our goal of that program is to help students really understand that it's not just about your education. Education is important, but there's a career after that. So what's the right educational path to attain that? And I think, Josh, your point is really important, is that you can start out in the medical field, same with you, Jason, and I can think I want to do this, but then I can kind of get close up to the action and go, ooh, I really want to be this. Like, this is interesting to me, whether it's, I'm nerding out on numbers and I want to be in billing and accounting, or whether I started as a CNA, but I'm really interested in the surgical floor and what I'm seeing there, and I want to get into whatever it may be, right? And so you have that exposure, but we've really appreciated that opportunity to partner with Confluence on Careers After School and bring kids through and see all of that, because a lot of folks don't know the vast opportunities. So maybe you can talk a little bit more about the outreach you're doing in the community to educate and kind of grow our own. And we've got partnerships with Wenatchee Valley College and other folks to really keep our healthcare community strong in this region to provide us with access.
Yeah, a couple things. We're doing a big program that we're rolling out right now. We're lacking in CNAs, so certified nursing assistants. And it is a difficult job, but it's a job that people that start to do it, their feedback is, I feel like I'm really adding value. I feel like I have a purpose. And so because we're lacking staff, we've actually partnered with the college, and we are have jobs posted right now where we will pay for people to go through the fast track program at the college. We'll pay for their college our month-long course, and then we'll actually pay them while they're enrolled in the class to go be a student. So they will have an hourly wage to go take this class. We'll pay for the class, and then upon completion, we will put them through our CNA residency program where they get additional floor training and skills and things to go out onto their job. And so that's something that we've partnered with the college on. We work closely with them with our nurse residency program, medical assistance program. We were talking before you walked in about the meeting we had with them the other day. And then we also work with the high school quite a bit through the health occupations class. And I know Casey works really closely with them, and we do as well to try to either go in and do mock interviews with their students, because they have a group of students that when they finish that class, they can sit for their CNA exam and become certified if they want. They've done all the prerequisites and requirements for that. And so we go in and try to help them think through, is that a career you want? Is it something you want to do right now? Is it something you want to do down the road? And so we work with them in a lot of ways, and our goal with that group is to try to get, pharmacy in there, lab in there, rehab. A bunch of different groups that students might, a high school student might not necessarily think of as jobs that are available to them when they graduate.
That's great.
Who's your biggest competition? Is there such a thing, I guess, as competition in the world of acquisition? I would imagine so, but you have so many different compartments at Confluence that people can fill positions within. Is there another industry or another sector of employment that you really kind of battle to keep them out of and try to swing them over to you? Or
I think it depends on the type of job. COVID has opened up the world of remote work exponentially. And so positions that we probably felt pretty safe about having here, as far as we won't lose someone in IT to something or whatever because they don't want to move, can go online and apply for a job in Seattle and start working the next week, or Arizona. And so that has created competition that wasn't necessarily there a year and a half ago, or it was there, but people didn't really think about work in that way. On the clinical side, there's other organizations, and then we...
Sure. I think realistically now, when we talk about the healthcare side of Confluence, we're really competing with the world. It's no longer just Wenatchee. There's certainly some local competition, but really most of these folks that you might think of as competition, we really partner with. If you think about long-term care, for example, they hire nurses, they hire CNAs, and where we're thankful that they do. Because our patients don't always discharge to home. Sometimes they have to go to extended care facilities, and so we want those facilities to also have the staff that they need. But in years gone by, we would have maybe viewed these other groups as competition. Now, not so much. Almost partners in the industry. We're all kind of competing for limited resources. I think ultimately our job is to make sure that the community understands what all we have to offer when it comes to employment. Again, it ranges from, Josh mentioned the high school program, outstanding program. Not every kid in high school knows that they want something to do with healthcare. Not every kid in high school knows that they want to go to college right away. And so it's important to consider, I think, Confluence Health as a stepping stone, as an opportunity to try something. Maybe you haven't considered healthcare per se, but and maybe you want to see what it's all about. There are entry-level jobs that don't require hands-on patient care. Lots of exposure, supply chain, various other things that get you into Confluence Health without necessarily putting you on the front lines. But maybe it's that exposure that convinces you that I do want to go into healthcare. I want to be patient facing.
Yeah. What are some of the newest things that are either already kind of burgeoning or perhaps coming up in the future as far as employment at Confluence? Because again, it seems like with the arrival of technology, we add departments all the time to all kinds of businesses. So is there anything down the pike that is exciting that we could talk about in that regard?
Well, it's kind of hard to know what's coming right around the corner. I think right now we're pretty deep into trying to fill our frontline caregiver roles. I will say the pharmacy tech program that has been started out at the college is fantastic. That is an area of growth. We're going to need that program full. And I would certainly encourage anyone listening.
We'll give a quick plug for the college program because they're still accepting applicants.
Absolutely.
There are 0 prerequisites other than that you have graduated high school or have your GED. And pharmacy techs make good money when they graduate after a year. And so go online and look up the program because they are accepting students, I think, through August.
Great. Mm-hmm. So we talked about the competition, but we've heard from years that we have some pretty talented medical professionals in our region that maybe wouldn't normally come to a community like ours, but yet they find something magical in this place, whether it's the outdoor recreation amenities or the size of the community and the quality of life elements. So I don't know, maybe give a few shout outs, or I mean, we've got some pretty amazing talent at Confluence. We're not like, oh yeah, second fiddle. I mean, we've got some pretty incredible doctors that have come from some really prestigious universities and other medical communities. They've chosen at key times in their career to come here. So maybe you can share a little bit about that.
Yeah, so, and I think Casey might have some thoughts on this as well, but, historically, pre-affiliation, the old school Wenatchee Valley Clinic or Wenatchee Valley Medical Center was unique. It was unique to Washington. It was certainly unique to a town of this size. What made it unique is that it was patterned after the old Mayo Clinic version, where you house all your specialties together. And that makes it attractive for new docs who want to start a practice, but also want to feel like, hey, I've got partners one floor above me that can help me sort through this. And so that is really one of the fundamental ideas behind how we started with the clinic. And over the years, the many decades now, it grew and grew and grew, and we pulled in, whether we're talking cardiologists, whether we're talking, vascular surgeons, urology, the list goes on and on. We have really a unique opportunity here in Wenatchee to not have to leave the valley for much health care. And I think that is not something that we're seeing lessen. Mohs surgery is here, something local that we hadn't had prior to, 5 or 6 years ago?
Yeah, about 6.
We hadn't had Mohs surgery, and that has a lot to do with dermatology. The ultimate, I think, for providers that aren't wanting to go into business for themselves is to find a group of partners to support their practice, help them grow theirs, and really kind of just invest in a community, shared patients.
Yeah, and I can add to it a little bit, just in knowing, getting to know some of the new providers as they've come on board. There's always, of course, everybody has their own story, but there's always, it seems like everybody that I've talked with has some sort of reason. It wasn't just I'm looking for a job. Oh, it looks good, like a good-sized town. I mean, yes, we have a lot to offer in Wenatchee as outdoor rec and family, being a very family-centered town. But, I think a lot of the med students we've housed talk with their friends during residency and say, well, yeah, I did a couple medical student rotations there. It was great. And I've heard 2 different providers say that's actually how I found out about Wenatchee, or providers that have previous, chief residents in their residency programs recruit them to Wenatchee. And so there's some sort of personal connection with a lot of the newer providers that I've seen, and maybe Josh or Jason can speak more to that, but that's what I've seen in the new providers, is that there's some sort of personal connection where someone said, it's not a huge city, it's not a university, but it's a great place to live and a great place to work. And I think that's kind of where it comes down to.
Yeah, and Shiloh, this is where we get into the overlap of everything, I guess, that we've been talking about throughout this whole series. Yep. You think about young people wanting to relocate for maybe their first job or their first professional job in the healthcare field, for example, maybe even IT. They might be looking for something a little different if they haven't started a family yet, so they're looking for outdoor recreation. They're looking for opportunities to have fun and to kind of build a life around a place. If you're a little bit older, you're more established, you have those kids, you're looking for things like, low crime, and not that the younger people aren't, but it's probably not top of mind, but other things, they're looking for things that are more family oriented, like Casey's saying. So again, this is where the whole overlap of everything that goes on in a community sense, in a professional sense, a business sense, from a structural sense, as far as government's concerned, everything we do here in the Wenatchee Valley, that's kind of the glue that binds it all together, and that's how we know we're doing a good job when we get a lot of people relocating to the area, and we certainly have that in all sectors, including healthcare.
And, I really think about that as the mission of the Chamber, championing our community's quality of life and economic vitality is the first part of that mission statement. And that's true. If we have a strong economic center, right, and we have high quality of life, then yes, the talent will likely go, oh, hey, I want to know what's over there. But I think one more thing before we let you guys all get on with your day is Confluence has done something pretty impressive for the region, and that is a lot of these small practices, right, independent family docs, maybe they had a nurse in their facility or whatnot in our smaller communities where, well, I'm retired retiring and nobody wants to buy my practice, or things are a lot different. And so we've got a lot of our Confluence doctors that are out in our rural community providing access in hometowns. I mean, whether you're as close to Kashmir and you have your little facility there, or you're up in Tenasket, or, all the way
Waterville,
over
Grand
everywhere.
Coulee.
I mean, there's all these great little, places for physicians, but that's got to be a really unique place or position or talent to acquire and fill. So can you talk to, I think us in the city take that for granted, but it's really an important part of your mission in providing care to the region, because you're a regional facility. It's not just about Chelan or Douglas County. You support Grant and Okanagan County. I mean, it's a huge territory, an important organization to that. But I just feel so, when I'm out in those small little communities recreating, I have access still to great healthcare. Right. So how do you guys keep those things going?
I think it's a big challenge. But I think, it's really cool to see from the very top of our organization down. One of the most important things we're focusing on is trying to keep care local, trying to keep patients from having to come to Wenatchee or go to Seattle, trying to keep them. And so having these small clinics that are within our system allows them to communicate with specialists more easily. And so knowing as a new family practice doc that's starting up in Tenasket, it's easier to recruit them there because they know they're within this network that's really supportive, and they can very easily contact by cell phone, text, different modes of communication to get the support they need to take care of a patient and try to keep them in their hometown. So I think that's one of the big perks of being part of an organization like this, whereas an even larger, affiliated organization it's not as personal. You might have access to subspecialists, but you don't know who you're going to get. Whereas we're still a small enough organization that they can say, oh, I'm going to call Dr. Smith because I know her cell phone number, and I know she wanted to talk to me about this patient. I know she's seen this patient, and I can talk to her directly. And so I think that's one of the big draws to working in our rural communities. But it is still a challenge for sure. Getting people to move to those areas is still a big challenge.
It's beautiful.
It's a different world than it used to be. I know the doctor that we had when I was a kid, Dr. Nash, she used to make house calls. He came and she gave me a shot one time at home and dug glass out of my feet. And yes, lollipops were involved. So, it's kind of dating myself there. But the world of healthcare has changed. But again, in those rural communities that are actually, in some instances, some are growing, but others are losing some of their population base. And yet they still need to serve the folks that are staying behind to live and raise families there. So it's great to know that Confluence is spread out. How many locations do you have, satellite clinics? Do you know just off the top of your head, anybody?
Is it 14? I think it's 14.
Yeah, I travel extensively all over the state, and I see them all over the region. I'm always surprised. It seems like I see a new one every time that I go out. I know it's been there for a while. But oh, there it is. Yeah, exactly. Well, it's been a pleasure to talk with Confluence Health in studio today. Again, Casey Vogt, Jason Morley, and Josh Brack all here today with us, along with Shiloh Burgess from the Wenatchee Valley Chamber of Commerce. This, again, is part of our Community Connections podcast series with the Chamber, and you can find this any place that you download your favorite podcasts online or at our website, KOHO101.com. There's also links on the Chamber's website, Wenatchee.org. Shiloh, Casey, gentlemen, I appreciate the time very much. Thanks. Stay well. And Shiloh, I know we'll talk to you again down the road.
Yes, absolutely. Thank you all for being here.
Thank you very much.
Thanks for joining us for the KOHO 101 Community Connection Podcast, a look at business in the greater Wenatchee area.